So here's another short video in the pain tips series about imagining pain or imagining a stimulus. So let's take this upper trapezius pain as an example of someone who says, I have pain on light touch. So they might press lightly and that actually brings on their pain. So we know it's a hypersensitivity to a non-painful stimulus. So what you can actually do with this is get the patient to place their hand on that area of the body they feel pain with light touch. But you just rest the hand on it. And this is another one of Howard Schubiner's tips in his assessment of patients who have persistent pain. And he uses this really to good effect, and when you actually use it in clinic, or you can use it as a patient yourself and test it, and it'll highlight how sensitive that neural pathway is to imagining the pressure. So if it's light touch and the person presses and it brings on their pain just to light touch, get your hand, ask them to rest their hand in that position, and then get them to close their eyes and simply imagine placing light pressure on that area. Now if that elicits pain, that's pain that's coming without any pressure. That's an example that it's their brain. That simply illustrates to them that that neural pathway, that predictive coding, that anticipation of what's coming next triggers the pain without any new physical pressure. So it's another opportunity to show them a tipping point, or for you as a patient to understand that actually it's the expectation of pain that actually makes it more likely to fire. That pathway can be reversed, and if you look out for some other short videos that explain how we can do that and how you can do it. Keep looking out for these little videos, build up that evidence that convinces your patient or convinces yourself that pain is as real as the experience in which you feel it, but often it's driven by perception that's developed over many years that actually you can change, and you can change the experience of the pain by changing your perception.